Most people brush daily and even include flossing into their hygiene routine. Yet, majority of people still deal with dental disease at some point in their lives. According to CDC's National Center for Health Statistics, approximately 91% of U.S. adults aged 20 to 64 had dental caries, and by the age of 65, that number increases to 96%. In this speech, I'm going to educate and urge listeners to maintain proper oral hygiene in order to prevent dental diseases. In order to provide an understanding on why it is important to maintain oral health, I'm going to explain the most common forms of dental disease, how they are prevented, and proper hygiene instructions. When it comes to oral hygiene, many people believe they are taking the necessary steps in order to maintain their oral health and are often shocked when diagnosed with dental disease. Although most people are brushing daily, I'm going to discuss tips to make your oral hygiene routine more effective. According to the Association of Healthcare Journalists, the most common form of dental disease found in children and adults is dental caries, also known as cavities. Cavities begin when demineralization occurs at the surface of the tooth, often hidden from sight in the grooves of the teeth and in between the teeth. The destruction spreads into the softer, more sensitive part of the tooth, the enamel. This is also known as the dentine. The weakened enamel then collapses to form a cavity, and the tooth is progressively destroyed. Caries can also attack the roots of the teeth should they become exposed by gum recession. This is more common in older adults. Dental caries is caused by the acids on the enamel surface. The acid is produced when sugars in foods or drinks react with bacteria present, or the plaque. As posted by the Dental Health Foundation, the most effective way to prevent cavities is by lowering sugar consumption, proper brushing and flossing techniques, and having your dentist apply sealants. Sealants are a material placed in the grooves of the teeth to prevent bacteria from getting trapped in the deep grooves. Next, I'm going to discuss the disease known as gingivitis or periodontal disease, other known as gum disease. It is caused when the bacteria and plaque builds up between the gums and teeth. When the bacteria begin to grow, it can start to calcify, making it very difficult to remove without the assistance of a healthcare professional. If left untreated, this inflammation can cause the gums and supporting bone structure to deteriorate. This can lead to gum recession or even tooth loss. In addition to research by the American Academy of Periodontology, it has shown that gum disease may be associated with other diseases, such as diabetes and heart disease. Periodontal disease can be prevented with brushing, flossing, using mouthwash, and knowing your risk factors, or things that can contribute to the gum disease, such as age, diet, smoking, and even genetics. An article by Jay Curtis posted on Colgate's website mentions techniques and tips to provide the most effective oral care at home. When trying to brush teeth quickly and in back and forth motions only, plaque can be missed. That is why it is best to follow the American Dental Association, ADA's, recommendations for proper brushing techniques. It is recommended to brush teeth for 2 minutes twice per day, morning and at night. Brushing should be done at a 45-degree angle to make sure that you're brushing along the gum line, and use short back and forth strokes across the sides and tops of teeth. Then hold the brush vertically and use several shorter strokes to focus on the backs of your teeth. Like brushing, flossing must be done properly so that when you reach between the teeth, you actually get the germs that are stuck there. Ideally, you'd use a piece of floss that is long enough to allow a fresh area of floss every few teeth, without reinserting bacteria you removed. In addition to proper brushing and flossing, mouthwash can be used to assist in getting rid of bacteria in hard-to-reach places. While the tips and more effective at-home oral care can greatly decrease the chance of dental disease when you put it into effect, it is still important to keep up with regular checkup and cleanings. It is recommended by the ADA to see a dentist every 6 months for an examination and cleaning. Dentists can detect early signs of cavities and gum disease and treat them before major damages occur. At your checkup, a professional cleaning can be performed as well to provide a better cleaning and remove plaque in areas that you may not be able to remove at home. In addition to examining for dental disease, dentists will often perform oral screenings at your checkups. As mentioned above, dental disease can cause severe damage to teeth, gums, and is even related to other health conditions. Proper oral hygiene can be achieved in a small amount of time each day and can greatly decrease the odds of dental disease. Proper at-home hygiene, in addition to regular checkups and cleanings with your dentist, can have you on track for a lifetime of oral health. I would like to encourage you to take into consideration the advice mentioned above and put them into effect sooner rather than later.